been practicing Chinese herbal medicine since I became an acupuncturist in 2002. I trained at a school that offered simultaneous 5-element and TCM tracks at the same time. So there was the Worsley 5-element tradition, a Japanese 5-element track, and the 8-principle track for Chinese medicine. So it was really cool for me to get that kind of perspective in my Chinese medical training. I felt like it served me well, not just at exam time, but also as a practitioner, to have all these tools that are available in the whole of Chinese medicine. And so what I really appreciate about the program here at the Academy is that it also offers this more well-rounded view and training in Chinese medicine. So Chinese herbal medicine, as you may know, is ancient. It's a 5,000-year-old tradition of medicine with a 3,000-year written lineage. So it's been around a long time, and the lineage is unbroken. Unlike in Western medicine, where a lot of the information got lost during the Dark Ages, they didn't have that in China. So it's been an unbroken written tradition. And the other thing that's helped preserve the integrity of Chinese herbal medicine is that the written language in Chinese is pictographic. So modern people can read ancient Chinese, and it's the same on the page. It's not like trying to read, ancient Greek or ancient Latin or even Old English for us today. So there's no trouble with reading the ancient texts if, of course, you can read Chinese. That's a whole nother issue. So it's said that Shen Nung, the legendary Emperor Shen Nung, tasted the myriad herbs, and he's considered the father of Chinese herbal medicine. So what it's said that he did was he tried all the herbs, every single one of them, to see what they did. He wanted to check it out on himself, right? This is empirical medicine, right, at its absolute most basic. Let's see what this does to me. And this is kind of how Chinese herbal medicine works. And over the history of its development, it has worked this way. Let's try these herbs, this part of this plant, that part of this other plant. What does it do? How does it affect the human person? And what happens when we mix these herbs together? Then how does it affect the human person? How can we treat both root and branch of any disharmony in the body, mind, and spirit? So just as in the 5-element acupuncture part of the program here, where you're trained to treat the root cause and therefore affect the branch. So your person comes, as Pam was saying, your person comes with the migraine headache. Well, let's treat the cause of your migraine headache so that it eliminates the headaches, treating root and branch. And in Chinese herbal medicine, and in the herbal medicine program that we have here, this is part of the focus. But of course, we come from the 8-principle aspect of Chinese medicine, so that complements the 5-element acupuncture track that we have here at the Academy. The Chinese herbal medicine system, as you may well be aware, is very safe and very effective, largely because in the system, instead of using extracts of active ingredients, we use the whole plant or the whole part of the plant. So all of the constituents of that plant or plant part work together to balance each other out. In our view, there isn't just one active ingredient in a root or a leaf or an herb. So we use them all, and we use them in combination with other plants. There's almost never a single herb prescription in Chinese herbal medicine. It's usually a formula. So the Herbal Studies program here is separate from the Masters in Acupuncture program. So you would have to register for it separately if you wanted to take it. But it does happen concurrently with your Masters in Acupuncture program. It starts in the second year, and it's a 27-month program. It's over 700 hours of training, including your classroom time and your clinical time. So it's pretty thorough. It's pretty thorough. It integrates the 5-element training that you'll get in your Masters of Acupuncture program, along with the 8-principle aspect of Chinese medicine. And basically, what that means is we take the view of nature and how that happens in the microcosm of the human person, and we just look at it a little bit differently. We look at the climate of the person by assessing what their 5-element picture is. And then we assess, how's the weather in there? By looking at the 8 principles. Is it cold? Is it hot? Is it damp? Is it dry? What's going on? What needs to be rebalanced to bring this person back into health? Now, Chinese herbal studies, training in this is required for licensure in many states. Florida is one of those states. So if you're planning to practice in Florida, Chinese herbal studies will be required for you to get a license. So if you're not planning to practice in Florida, you want to check with your state's licensure requirements to see if it's required. But even if it's not required, most of our masters in acupuncture students choose to take it in order to get like all of the sides of Chinese medicine. As I said earlier, it's really helpful at exam time because you do get tested on this 8 principle stuff for the national board exam. Upon completion of the Chinese Herbal Studies program, you get a certificate in Chinese Herbal Studies and you're qualified to sit for the NCCAOM National Board Examination in Herbology. NCCAOM stands for the National Certification Commission for Acupuncture and Oriental Medicine. It's a mouthful, but they're the national oversight and testing agency for acupuncturists in the United States. You'll hear about them a lot if you decide to embark on a career in acupuncture.
And you'll pay them a lot of money.
Oh, yes, you will. Get ready. So the educational objectives are what we're actually going to do in Chinese Herbal Study program. You're going to, first of all, you're going to learn about the 8 principles. We give you a foundational training in this way of looking at disharmony in the body that's part of Chinese medicine. And this is what they call, in modern times, they call it TCM, or traditional Chinese medicine. And this is the way that you view the symptoms and complaints and everything else that you discuss and learn about from your patient. This is how you compile this information to choose what herbs you might prescribe for this person. Speaking of prescriptions, you'll learn the most common single herbs and formulas in the Chinese pharmacopoeia, and you'll learn the preparation methods. So you'll learn how to make a decoction. We'll talk about how to make an herbal pill. We'll talk about how to, you'll get hands-on training in all of this stuff. You'll also learn how to formulate and mix either raw herb formulas or granular herb formulas, and you'll learn how to prescribe patent remedies, which is what we call the already prepared pills and tinctures that you can purchase and prescribe for your patients. You'll also learn how to modify formulas. So we have these books. Someone asked earlier today about books. Chinese herbal medicine is all about stuff, and boy, do we have some stuff in Chinese herbal medicine. So these are the books, the main books that we use. This is the materia medica, which means this is the book full of most all of the single herbs that you will ever want to use in Chinese medicine. These are those little thin little pages too, so there's a lot of herbs in here. You don't have to learn every single one, but you learn most of the most common ones. And then this is the book of formulas, and it talks about the traditional, some of these formulas have been in continuous use for thousands of years. So it's really cool to be part of such an ancient lineage that is also alive and growing and changing and evolving, because modern life is a little bit different from ancient life, yes? And so we have different disorders that come up more frequently in different ways that we need to help people rebalance. So we modify formulas and change them a little bit, add herbs or change herbs to make them more appropriate for our modern patients. It's really cool to be able to do that. We train you how to do that. We also train you how to do traditional diagnosis. So traditional diagnosis in both 5-element and in 8-principle, they include asking diagnosis, where you have to talk to your patient and ask questions, not just about their most pressing symptoms that are presenting, but also about all of their systems and how things tend to work for them in the whole body system. Also, you have to look at your patient. We do looking diagnosis. What is the skin tone? What is the color that shows up most often for this person? You look also at the tongue. We have the patients stick out the tongue And that's actually a diagnostic tool for us. Very simple, very non-technological diagnostic tool that we have in Chinese medicine. You have to also listen to your patient, not just to the words that they give you, although those can be very telling, not just on a symptomatic basis, but the kinds of words that people choose give you a look at maybe what element might be most predominant for them. It's really interesting that people will say, you know, oh, I have to deal with all this crap all the time. My life is it's a mess. And you start to think, well, maybe they're having a little bit of trouble letting go, and the mental element could use a bit of work. This sort of thing you learn from your patients. You also listen to the sound in the voice. The sounds in the voice will indicate what emotion might be most out of whack or in whack for your patient. Let's see, asking, looking, listening. Oh, you even have to detect odors for patients, which is very interesting in modern times where everyone is so clean and well perfumed. But that's another aspect. So we use all of these, we call them pillars of diagnosis. Oh yes, and finally touching. We touch our patients. We actually put hands on patients, not just to locate and treat points with acupuncture, but also we feel the pulses at both wrists, as Pam mentioned earlier, and we feel the abdomen for different diagnostic clues, and we'll also palpate or assess the meridians and channels. Even when we're working in the herbal medicine aspect of Chinese medicine, we use all of this information. So this is a very patient-centered medicine. We also teach you practice management skills, patient management skills, and the business of herbs. So how, for example, are you going to price your herbs so that you stay in business? This is important information if you're going to actually make use of your training, which is what we hope you'll do. So we teach you that too. The program is structured in an intensive format, and what we do with the Chinese Herbal Studies program for people who are also taking our acupuncture program here is we add 4 days to your intensive. So you come for your session here at school, and there will be an extra 4 days of herbal studies if you choose to take the Chinese Herbal Studies program.
You get a day off in between them.
That's true.
One day off in between them.
That's
so
true.
You go the whole time for the acupuncture, and then at the end you get the...
Sometimes it's that way, or sometimes herbs comes first. And that will always be posted in the schedule. It will never be a surprise. It will be well
And in fact, I have
informed.
schedules for the next upcoming class that I'll give you during my talk.
Which is really, really handy. It's really, really handy. But the Chinese Herbal Studies part doesn't start until year 2. So I think it's the third intensive. It begins with the third intensive. So you come twice in your first year and just do acupuncture. And if you choose to do herbs, then that starts the second year. And then your clinical residency happens concurrently with your acupuncture residency. So that last year, it's the same time period. You would just be doing more in the clinic. And so some of your days in the clinic would be working with herbs with your patients instead of working with acupuncture. So that's how that works. We also have a Chinese Herbal Studies program for acupuncturists. This is the same material, but it's presented for people who already are acupuncturists or who are going to another accredited school that only offers acupuncture and they want to take herbs too. We offer this for people who qualify but who are not part of our acupuncture master's program. So that is also happening. So you might have people from someplace else in your herb studies class, which is always kind of fun. You get to meet new colleagues that way. Yeah, so do you have questions about any of that so far? That's quite a lot of information, yeah.
Where do the herbs come from? Do they come from China?
Good question. Most of the herbs do come from China. Our herb suppliers are all GMP certified, which means good manufacturing process. So we make sure that we only use herbs from suppliers that have this certification so we can be sure of the quality. So these herbs here, these are some of our raw herbs. This is one of my favorite. This is Danshen Codonopsis. It's a qi tonic, and this is a root. And you would actually prescribe this to your patient. You would put it together with some other herbs, and they would boil it up in a pot and drink the resulting soup.
So
This
the raw herbs are almost always presented as a tea, is that correct?
as a tea or as a decoction is what we call it, because you boil the herbs for a while to water extract the constituents into the liquid, like making soup, like stock, but herb stock.
You
Yeah.
would never grind and like the capsules? Do you
Sometimes we do grind the raw herbs to make them easier to decoct, or we'll grind them to make them into pills. We also have granular formulas. These are the ones that these are powdered decoctions that you can encapsulate, and we do that sometimes. It's pretty labor intensive. You got to love your patient a lot to make the capsules.
And then
So-
those are formulas those others.
Yeah, these are the patent herbal formulas. So these are ones that are already prepared, either pills or tinctures. And these are some of the companies that we use most often. And again, they're very reputable. Most of the manufacturers, these two in particular, are American. The factories are in America, so there's a bit more assurance of how high the quality is. But so there are times when it might be most expedient to prescribe a pill or a tincture for your patient. You might need the formula to be ready-made, or they might just prefer that method of delivery. And it's good to know what's available and what you have as tools for your practice as practitioners. And then when we dispense the granular formulas, like this is how we dispense those. They come mixed up in a bag with a spoon and instructions, and this is how we dispense those to the patients. So, question?
How many plants, herbs, substances in the materia medica?
Oh, back in my day when I went to school, there were 300 and some odd substances in the materia medica. Now there's more.
Over 1,000.
Yeah. We don't train you in all of them because a lot of them we don't even use anymore. Some of them are parts of animals that are endangered species, or some of them are plants that we just can't get here in the United States, for example. So we don't, you're not going to be able to use them, so we don't spend time. Some of them we learn about, for example, rhinoceros horn. We don't use rhinoceros horn in this country. It's actually banned. But the actions of that substance are very important to know about, because some of the traditional formulas include that substance. You have to know what you can substitute that does the same thing as the rhinoceros horn that you can't, use. So that's the type of stuff that we train you in, in the program. Yeah, but there's a bunch. I will be honest, there is a lot of study involved. We do a bunch of hands-on stuff when we get into the clinic in terms of mixing the herbs and treating the patients. But before you get there, there's a good bit of information to get in there. But it works. It works out. Yeah.
What about knowing about the pharmacology stuff of like if people come to you with they're on different drugs, like would any of these be contraindicated?
Yeah. I'm so glad you asked that, because that's another piece of your training. So you do need to know like which herbs, like we do train you in herb-drug interactions, what herbs you don't give with which drugs and so forth, which herbs could substitute for which drugs if the patient is trying to get off a medication with the advice of their medical doctor. What can you do to support them in that process herbally? And also herb-herb interactions. Which herbs are toxic when you use them together? You don't want to do that, Which herbs do you never mix together in a formula? And also, which herbs might ameliorate the toxicity of another herb, which is one of the reasons why we make formulas in the first place. So yeah, we do. Does that answer your question? Cool, yeah.
Does the moxa procedure fall under your umbrella?
The moxa in this school, they train in the acupuncture clinic, because when you use moxa, when you're doing acupuncture is when you would use moxa. So moxa is an herb. And you do learn about the properties of Artemisia vulgaris, which is mugwort, which is moxa.
Are there different kinds of moxa?
It's one plant.
It's one plant.
It's one plant. Yeah, it's one medicinal that we use as moxa. So we teach you about that in the herb program, but the way that you use the moxa, by burning it in the acupuncture treatment room, it happens in the acupuncture treatment room, so you get trained with that in acupuncture clinic. Yeah, good questions. Got more? I love questions.
I
understand that you start herbs in the second year. For the third year while you're in clinic, are you also having classroom time, learning the herbs?
Yes.
What does that look like in terms of a schedule for that last
So
year?
by the time you get into the last year and have started your acupuncture clinical residency and are starting your herbal clinical residency, there are also weekly classes in herbs. So I think right now the way we have it scheduled is we have herbal clinic on Fridays. Herbal weekly class is on Wednesday mornings, I think. It's a half a day class. And you get trained in things, for example, you get trained in things like colds and flu, right? So you take this Western medical diagnosis and you have a whole class on how do you differentiate this according to Chinese medicine treatment principles and what would you use to treat it. So that kind of thing happens. Yeah, it's pretty neat. Yeah, good. Other questions?
Do you ever incorporate Western herbs?
Yes, thank you for asking that question. We do incorporate Western herbs, and we have a few that we are now stocking in our pharmacies, both in the raw herb pharmacy that we have over here and the granular pharmacy in the other building. And it's very exciting because there have been a number of herbalists who have embarked on the study of how do we classify these Western herbs by Chinese medical classifications. Is it warm? Is it cool? Is it hot? Is it cold? You know, what channels does it enter? What actions does it have? So we're able to talk about it in a Chinese medicine kind of way. And that way it helps us use them in our formulas, the way that we're being trained to use formulas. Also, there's a botany component in, so we do study, you know, Western botanical science, like we, you know, parse out the plant parts and take plant walks and look at different things and talk about roots and rhizomes and leaves and stems. And yeah, it's really cool. Really cool. What else? Yeah?
Well, I'm just curious as to having such a long tradition, has Chinese medicine not have more acceptance? And how come Western medicine, which is really quite young by Chinese medicine standards, is so prevalent?
We have this lens. Here in the United States, things are a certain way. And Western medicine, what we're calling Western medicine, is the most accepted form of healthcare here. In other countries, that isn't necessarily so. It's a big planet, you know. So in other parts of the world, particularly in Asia and in East Asia, and most particularly, Chinese medicine is an accepted part of life. If you go, even here in Gainesville, if you go to the Chinese market, there's a whole aisle of tea. Well, on the aisle with the tea is also Angelica sinensis, which is a blood tonic, Gansao licorice, which is a qi tonic. You can find all different kinds of ginseng. It's all just part of life. You know, you make ginseng and chicken soup for supper in the wintertime. If, you know, that's like a traditional Chinese regular meal, right? So it is gaining more acceptance in the West. You know, ever since I've been involved with Chinese medicine, which has been for 20 years. Before I went to acupuncture school, I used to work for an acupuncturist and an herbalist in their clinic as my title was office goddess. It was a very exciting title. You know, I've watched it grow and get more accepted here in this country. I think there are always going to be reactionary camps, you know, people who don't want things to be weird or different. So there can be a lot of non-acceptance of something that is weird or different, you know. And I think that for some people, because scientific Western medicine is the accepted form of healthcare here, this looks weird or different. But this is 5,000 years old. And to other people, Western scientific medicine kind of looks weird and different. So
I think it's considered in some maybe minds to be more advanced and intelligent, you know?
I certainly feel that way. You know, I have a bias, but yeah, I certainly feel that way about using the plants that are there as medicine. I think that's what they're there for.
You mentioned, just as an aside, that you studied also a trajectory of Japanese 5-element acupuncture. How was that, in very brief terms, how was that different or from the...
You know, that's Not a training that's offered here at this school. But I will say that I did have to train in that. Like, I got an introduction to that at my acupuncture school way back when I went to school. And then I had to pursue that as a postgraduate education. So actually, Pam did mention Toyohari acupuncture. She was talking about where you don't even insert the needle. This is the style that I do practice. And the training program for that is offered not in the school setting, but rather in a postgraduate, they call it a continuing education course.
So if I moved to Tokyo and went for acupuncture, it would be a different kind of acupuncture?
It might be very similar in terms of it being 5-element based. You know, it's still classic, it's still based in the acupuncture classics, the Nanjing and the Neijing. It's still based there.
But there was a different tradition that probably originated in the Chinese, I'm sure, but that had its own path. Is that correct in terms of its evolution?
Yeah, that pretty much sums it up. Yeah, it's kind of like what happens when the...
With Buddhism, I mean, there was the Chinese Buddhism
Exactly.
and the Japanese Buddhism. So
Exactly.
they have their own traditions.
And it's real similar. Like when stuff goes to Japan, they take other people's technology, they make it smaller and more efficient. And that's kind of what happened with the acupuncture. It's true, you know, it's beautiful, and that's just the cultural way and the flowering of creativity that happens in China that's like so much more Baroque and ebullient, you know, that's their cultural way.